going to do today jawline fillers. Okay, jawline fillers. There is difference between the man and the woman, and this is the main thing that makes the face look masculine or feminine. So you should take very care about if you work on women or men. There is two things, by the way, that make the man: the eyebrow shape, to show the lips, and the cheeks and the jawline. The jawlines. Normally, you don't worry at all about the man when you do jawline fillers. Why? Because the more you inject, it's like the more you inject, the more you make it masculine. So whatever you inject, no worries at all. The outcome will come as a masculine. But the woman, no. You should take care if you make it like a man. Because the man, whatever you inject, it will still masculine. But if you work with the woman, you can make the face look like a man. Okay? We speak first about the man. Like when you look to the face like this, okay? With the man, the most important part, like the man face, should be barrel, like this, like a barrel. This is. Like this, for sure it's not like this exactly. I mean, this angle should be prominent. This is what the man wants, this part to be prominent. So when you work with the man, you should concentrate about the angle. Before we start, you should know that jawline filler, like to make fillers in the jawline, it takes so much fillers. So anybody ask about the jawline filler first, maybe they think, okay, I want half milli here and half milli here and half milli here. It doesn't work like this. Jawline fillers for women, for example, start from 2 and 2. 2 milli.
And we speak about filler or Botox?
Fillers now. I will explain to you it's the jawline. I will tell you how we will do it. I mean, we use also Botox. I mean, each case will come. Normally, how is about the man? A man, it's very hard for him to find that he has these jewels here. A lot of women have these jewels in this area, but the man, no, it's very hard because of the hair, because of shaving. It's always to make the skin tight, and also all the normally hair, like the man beard always have a lot of blood supply. So always when they get fold, you get fold all. But the woman, because there is no hair, the fat became more in the area with more blood supply. So where is the area with more blood supply in this muscles, because these muscles are active. So they start to have jewels here. But first we speak about the man. The man, it is very easy. The most important to understand most important thing anyway, the jawline is 3 parts on each side. This chin, the anterior part, the part in the front, and the angle. The angle is 2 parts. Vertical like this, in front of the ear, and this line, this part. And we can make a triangle between them to make this triangle, like this. By the way, it is with the man and with the woman, but according to the face, how you see, let us concentrate about the man now, because the woman there is a lot of things, but the man is very easy. What is the difference between the chin of the man and the chin of the woman? The chin of the woman is more pointing, but the man is beefed a little bit more, like or more broad, this part. So when I inject in the man, I never put one point in the middle I should always make 2. Also with the woman, I can make 2, but according to the face, you know. So the woman always, when I want to make her chin, this is more easy. I go like, this is the needle in my hand. This is the needle in my hand. Like I take the tip of the nose like this. I will find the needle like this. I go like this in the middle. Understand? Okay, and inject. So if you like, when I inject more deep, I make the chin like, when I inject more deep, I take like the volume come more broad. If I want it more pointing, I go superficial more outside and inject. So as long as I go superficial to the skin, the volume come more pointing. You understand? So this is according to the case. But anyway, the woman is 1 point. 1 point in the middle. Okay? So when I inject also, sometimes I find the volume when I work. I find that like the volume not only increasing in the middle exactly, I find it's like according to the space in the chin. Maybe someone had a trauma in the past, so this here there is fibrosis, so the filler push in this side. So what I can make, if I'm like this, for example, I inject and I find the volume come here. Normally, I press on it, I make pressure on it and go outside a little bit, not outside totally, and go to the other side like this, little bit, and inject. And also keep feeling. Here I keep the pressure already. This is like when I started already, I started to have pressure. So I push, I don't have more. Push the filler to push on the fibrosis on the other side. After I finish, like I look, make massage, make it like this. It's very simple and good. Normally the chin take 1 milli. Can take half milli also. But normally, also there is cases who have retruded the chin. The chin is in the back like this. For sure, it will take more filler, like sometimes 2-3 milli, other than the girl who have already fillers before and already the chin is in the normal shape. Even you can put half milli. You make it to make her psychologically comfortable, but it's normally you don't need. If you speak about, or even if you wanted to make it more pointing, as I told you, you go superficial. You don't go deep. Very superficial under the skin and inject. And try, because the tissue of the chin is like connected to each other. Okay, so always try to be in 1 point. Why? Like if I go now I take my point and I go. If I want to change the point, I don't go out of the skin. I go and change from inside. Why? Because this hole, if I got here, I take it like this, and I try to inject again here, for example. I inject, the filler will go out from the other hole. I want to make 1 hole. Really, this teeny hole can put out again the fillers. Also, how I make the chin. For example, this is a natural chin. This is the natural one. If I want to make it, like for example, the man, his chin can be higher than his lips, like more prominent than his lips, but the woman no. So it's masculine thing. The woman, you should take line like this, like from this tip to here should be in 1 line. I should not have like the nose and the chin and the lips behind. Like it should come in 1 line.
In 1 line or more down, no?
Yeah.
Or more or less, I mean, not up, or the woman not up.
Exactly. Look, it's according to the line is what I mean. The most important is the line. Like so here it hit on the tip. If I want to touch, I need to touch also the lips. But if I touch here and this was prominent like this, you know, and I don't touch the lips, so no, it's not good. From the side view, the lips look inside, and this is not natural. The natural, look, I touch all together in 1 line. I mean, it should be like, maybe this line like this, for example, but also I should touch the lips and the chin together. Maybe the girl have bigger lips. Okay, if I make this, okay, it can be. I mean, never that this here from here and here, the chin higher than the lips. That I cannot. If I make line like this, I don't touch the lips. No. Okay. It will come. By the way, you will know it by sense. By sense, you know. So this is the chin. Normally, when the when you look to the face, you should know what is the most important part of the, because it's much filler now. Like each milli the patient pay for, so it's like each milli more he will pay more. So he want to be happy. He sometimes he need to see here, and you see this the chin is retruded, but he don't know, the client don't know already how their face look. So you should concentrate what really will make the difference, and concentrate about invest first the amount, the volume in it. Okay. So if someone have retruded chin, first I make the chin until I reach, because once this became good, they will find result. You know, maybe he say I need more fillers here, but at least they make change. They will be happy with this. But to make here and the chin, it's still retruded. No, it's, you understand? So the chin area with the man and with the woman different. With the man 2 points, the woman 1 point. So this is how the woman, how I make it with the woman. I go like this with the tip of the middle. I take it like a guide to the middle point. I end it like this. Okay. For the man, the same like this, and I go like this. The same like this. This is the middle. I knew. I make like this. Here. And I. This is the man. For the man, the most important thing in the jaw line, you know, what people miss, this end. So we finish now the chin. By the way, I make the chin at the end, but I know already how much I will use and how much filler I need, so I start with this end. With the man, you should be honest. The smallest result, the most little result start from 3 milli on each side. 3 milli and 3 milli. They will make 3 milli and 3 milli, so 6 milli, and they will still find it's very, very little. Okay? So how I will make this? Normally I have a cannula, like from where to put. What is guiding? There is people have small jawline, like short, and there is big. Where is the point where I put this? The opening. This is the opening for the camera. Where I open the camera? Here or here or here. First, I have the needle in the cannula. I want to reach here. I want to reach with this tip here. So I think like this. Okay. Here. So I will go this direction, so I open with the cannula like this, and not superficial in the skin, under the skin. No, I want to be like this, 45 degree, like this. Like this. And use the cannula. This cannula is not for chin, for jawline, or because the fillers, type of fillers, I will explain later what is the type of fillers. There is hard, like hard implant, and there is soft. This is for a soft filler. So it's, you know, it will even the filler I inject, it will not go out. I need wide bore. I will show you the cannulas and the bores with the cannula. For sure I will not fill it like this. It should be hard. I just, let me make it. Let me consider this one. Because let me consider this is the cannula. Okay. I go like this. For example, I go like this. Yes. And you hold this. You always will find resistant. when you always find resistance with the cannula because of this part here, you know this,
Okay.
this catch the tissues
Mm-hmm.
from inside.
Mm-hmm.
So I change like this.
Mm-hmm.
And when you find resistant, hold, push, push, like this. Until you find you feel, and you already the bone of the and they never change
Out in the bone, right?
over the bone little bit. Not super, at least not superficial on the skin. You know, there is, you know, this is it's never the bone direct. This is a fat, like it's like muscle for sure. You go a little bit deep, okay, and inject. And when you go out, and but don't go out a lot. And
Mm-hmm.
so I go like this. So I go like this. And I concentrate to really, sometimes I go with the cannula, but I take the skin with me, like this. You know, I go, does the skin go out like this? No, I should be sure that I go like this. This is not the skin, like if I stop here, no. I leave the cannula, it will go out like this. So I should be sure here, like this, like this is the skin. I go. I push this skin like this already. And don't worry, it will never hurt anything bad. Don't worry, really. So until I reach here, I inject. Concentrate more in this angle, like this. And then like this. Then like this. So, if the cannula length is like this, here, don't put it here always. Put it like, for example, I inject here like that, like here, I reach here, but also I want to reach here. So this is the end of the cannula. But if I want to reach here, see, so I make it like this. By the way, you can make many holes. Like, I mean, if I make opening and I'm exactly. So I like you like I want to, for example, I want with this cannula from this to reach here. So I need to make the points here.
So
Okay.
you can make another point, right?
Yes, no problem. Yes, you can make 3, whatever.
But it will go out from this, no?
No.
Because you
It's
have
different
to
here.
right?
Here is not tense like this. This tissue is so hard. The nose, here, this tip, and this part is very tense. It already make pressure, like even the patient feels that like too much tension, like it explode. The pressure became so positive that it's push out. But here no. Here is like take already. And also normally, I even if I took from here, I concentrate in this angle. I already like, even I put another point here. Normally, like I make it like this, you know. It's not with milli, you know. I like, okay, I will inject here because I want to reach this way. But the woman, also when you open for the cannula, for the needle, it's don't open here at the end of the cannula. You know, you need to have space. Like you understand? Again, this is the cannula. I need the cannula to reach here, for example. So I don't make this come to the end of the cannula like this, you know. I need to have more space, no, like to control the cannula. I will not push the cannula till the end in the skin. So I take it like this, little bit, okay. So if I come here and I don't feel I reach here, I make another point, no problem. So this triangle, how I make it? I go from the here, like this, like this. Like this, and also it will be like points like this, like lines like this. I want to make it straight from here also. When I come here, make another hole from here. This for the man, by the way. Woman very rare that we need this spiral shape, this triangle. One girl needs something definition. Especially it became old-fashioned. This jawline for girl became old-fashioned. So also I go here, so I go like this. I also like put my finger always on the angle of the bone, like as a guide for me, you know? Like go like this, like this, like this, like this. So I make it from here
Mm-hmm.
and I make it from here.
Mm-hmm.
So you should know that you have only 3 milli. Like each line, I can put like half milli. So half milli, half milli, half milli, half milli, half milli, half milli.
Mm-hmm.
At finish.
Mm-hmm.
If I have 3 milli and the patient won't, like for the first time they have, like, by the way, 6 milli, it will be shocking for them. Oh my gosh, 6 milli. Yes, 6 milli, and you will see that it is very, very little. So you have 3 milli. Normally, the man, when they have augmented angle, this is the burial shape of the, this is the masculine thing, this part. When they have this part augmented, they get so happy. And even when I don't have enough for here, it even make it look much better. I don't, by the way, here I don't never put much filler for, like sometimes I make the colonel that he feels that I inject, but I don't inject here. Because for the man it will make like this, and for the girls, for the woman, they always have fat here and jewels, so I don't need to put more volume here. So the most important for the man, this triangle, and for the girl, by the way, I make it only one line like this, consequent like little bit. But you know, the cannula, when you work with the cannula, you never go one line and come back. You need to make it little bit, go one time and then change a little bit up. At the end, I need small line, not big triangle like that. And look, so as a man, I put his head on the back. The man is sleeping like this. I put the man face like this, and I am on this side. I go like this. This part at the end, first the angles, and then I go to the other side, make the same. The cannula like this. So it will be here. Okay. By the way, sometimes the jaw is different on each side. The bone, I don't care. I care about the bone. If the bone here is different than here, yes, some people have one side is. This comes with sense. I want to know the technique, and a lot of things come with sense. Nobody, no human is the same like another human. Oh, totally different. So then I make the angle.
For the woman also free and free, or it's too much?
Too much, but I can tell you that the woman, I will explain a lot of things now. You should know also before we start that jawline. When I do with filler, you should explain always fillers is to add volume. So if someone is fat and have double chin and a lot of fat here, it's not logical to inject the tells me I will put only some, he will be happy for 6 weeks because the line, the inflammation and so on, and this became more broad and then he will be more fat only. So I speak now with the people who have defined face already, no double chin, no fat here, no this, no, you know, so some woman or some man have this already like fat.
Already everyone has little fat.
Yes, little fat, but a lot of people already, like everybody thinking, I don't know, and they show me pictures, the picture before is totally different. Why you show me to make it like this? You are different people. This person is like no fat here and you are like this, you know. You should understand. And always, 100% with all cases make Botox under the jawline here. You know, it's also with, like, he will be happy with the jawline filler after time. Botox take like 6 weeks to start work, so it became more defined. He will be still happy also because filler will be a little bit broad, but Botox work on the muscle at this during this time, so it became more defined. So together working like this to keep the client very satisfied and happy for longer time. And for sure, Botox is the most beneficial thing, the best thing to do in the jawline. This is for the man, but for the woman, I don't need this triangle. If I augment this triangle with the woman, it will make her really look like a man. So, like I can say 60% of women have this jewel here. This part is fatty a little bit. This part is fatty. So, always, any filler you put it here, it will push this fat up. So already whatever you will do, they will not find this defined jawline. So what I do, normally I go to inject the Botox in the jewels like this, and from down here, all, and I concentrate in this jewels area from down to put more concentration. That with time also will lift this part up, and my work, it will be concentrated in this area and in this area. In this area, the girl will be so happy. Just if she finds this one point here in this angle a little bit, she will feel, it is defined. Even you can put 1 milli. 1 milli and 1 milli. You will go with the camera like this. You put 1 milli and 1 milli. The jewels, I leave it. I don't put. I put Botox to make it more defined. So, and this area, as I said before, the chin, 1 point. But this woman, this is the chin zone. You find it like this. This is the lips. This is the chin. And find these jewels and this face like this. These jewels falling, and there is curve here. Let me just do this. I can take this. Okay. For example, and the woman can start to have this curve here. The jewels, the jewel falling jewels. So I inject in the jewels Botox from here and here. Here some fillers. Here the chin will be more pointing. She will be having, look in the mirror, look to this pointing. She will make her head like this. Normally when she make like this, the jewel is lifted, and she will look to find this line here in the angle. She will be happy. But overall, like if you like this, like overall there will not be big change. So I mean, I put Botox here, and what I make was this curve here. There is woman, like there is curve like this here. You understand? Here, this part, like this. The best thing to do it really, if you go with cannula and make it like this, it will not help with it. It will stay the curve. So the best thing in this area is bridging technique. Bridging is always like the same. Do you know the Russian technique with the lips? Bridging, for anything you go horizontal for the line you want to do, like for miserable fall, you go like this, not like with the camera like this. It gives more result. Here in this curve in front of the jewels, the best thing to do is the bridging. You come here from in the middle, you make like this, one here, and keep filling here until you find the middle of the curve lifted a little bit. But if you go with the cannula or with the needle like this, it will stay the curve because it feel everywhere in the. I want to put
just to some points.
Yes, so for sure it's not good to make it like point like this. It will work, by the way, but the best is the bridge, because the curve is broad also. Like the curve is not only like.
And you put it, and when you go.
Exactly. Always the injection is like this. You put.
You put, and then you go.
You like this.
Yes. Okay.
Also the cannula, when you go, don't inject. Inject when you reach the points that you want. Like. Okay. For sure, this is like coordination from your brain. It will take time to make two things, that to go back with your arm and inject like this. It will take time with you, but you will do it. No problem. This is the jawline. For the girls who have fat from here, like here we speak about the jewels. Okay, we can make from here and here to augment from here and augment from here, and the jewels I put some Botox, so with time this will be lifted and more defined, and here augmented, so I will reach the point after, for example, 6 weeks. Okay, but the girls who are fat from here, big from here, never inject fillers. Explain good to them. Let them go to make this shape in another place better, that they will, like this is stupid things that you should never do, but advise so much and explain about Botox or Botox facelift, Nefertiti neck it's also Botox or jawline Botox, all the same. That we make here and here, and in the jaw like this, and the jaw like this. Make one session now, after 4-6 months another session, and definitely give result. Everybody after 2 months they will start to ask them if they lost weight. And to explain why like this, why do Botox? They always say, can I see pictures before or after? It's so hard to find a picture before or after of this. The clients who come one time and then after 6 months and you cannot collect the picture from them. So you should explain what I tell you now to tell the client. Normally our body distributes the fat according to the activity or the blood supply of the area. So when you have active muscles in the jawline and in the floor of the mouth, your body starts to make more fat in this area. When you inject Botox, you make this muscle weaker, you make less blood supply, so your body start even not only to make the muscle more smaller like the masseter, but also will make less fat in this area. Okay? Masseter Botox. Some two people, by the way, where is the masseter? There is a bone here. Zygomatic. Do you know this muscle here? Temporal. The masseter muscle attached come from here, all this area, go under the bone, this bone, and go like this from here. Normally, two types of people need to make the masseter. Masseter for like this exercise. Some people always they are nervous to clench on their teeth. Sometimes when they sleep they do it and they wake up like so pain in their masseter, and also they have a lot of headache because of this tension. So normally we inject this angle, but when it's more advanced also, you should understand when you make here Botox, this muscle became atrophied, but also this part sometimes became hypertrophied, like the muscle go up here. You know, sometimes I need to inject here and also here. But according to what you say, it's very rare. You just don't distract yourself about it. How I make the masseter? The masseter, you feel the angle of the bone. This is your guide, the angle of the jawline. This is your guide point. You always, like if I put this is I feel, for example, this is the bone. I feel it with my hand like this, and I ask my client to clench on their teeth like this. That you start to feel it. You will feel it. Okay. Look your arm. Yeah, this is the angle. What is the angle? What is the angle? Ask the client to clench like this. Feel it. Feel it. This is the muscle. Which exactly you inject. So if I inject, for example, here, I keep my hand here on this angle. I don't go so far, like I go like exactly 1 centimeter or half centimeter from this and inject. I like to inject 3 points like this, not 1 point, but I don't go in front of you. Here it will affect the smile. So I almost this is angle. Wallahi, I inject direct like 1 point, maybe almost this angle, little bit out of it. And I feel the bone, you know, it's the muscle. Some girls or some people have big muscle. This is it's like how many units I inject. Normally, some people you can explain. Normally, it's very big muscle. It needs like around 50 units. This is the average. 50 units on each side, 100 units. So some people say not too much. Okay, I only use half. For sure, 5 and 10 is nothing. But okay, I can make for you even 1 unit in each side. It's no problem. Like, you know. So if they normally if your client need result and they have big face, like broad face like woman, big from here, and she need to be more feminine, slim face. That's why, you know, you see the difference. The men like it's very hard to come here because they need big from here. But the girls, it's when it's big, the face not look nice for a girl. So you inject here to make it more slim. To make a strong muscles like this, slimmer or weaker, you need big amount of Botox. Botox cannot stop this muscle. Even you can inject 100 units in 100, unit here and 100 unit here, and the muscle is still working good. This is the masseter and the jawline. Okay. The most trick I want you, like this girls or women have this jewels here. Really, this is the best thing to do. Like sometimes care, like this results that show direct in front of the clients that will be later bad. Don't like this. Always look for your clients that they will be 100% come back. And this happening, they go and try another people and try the shit, but when you explain good, after this they leave. And what I'm telling you exactly what happening. When they inject girls who have jewels here or fat from here and they go to inject and they start to be shit fat, and like normal after 6 weeks, the jawline became not defined anymore, and for what they will do, they think to go again to inject fillers again, but they don't understand. We should always say, nobody see, you never see your face, even in a camera or in a picture, as the people see you. Never. Nobody from us know how we look. That's good. This is the jawline, Botox and fillers, and about the chin also. The chin also for the man. By the way, if I will come here and inject one, by the way, from the techniques of the injection, even from the cheeks, I can go with a cannula like this and inject, but I still also can go with the needle like this, make balls of injection like this. It will also give result. Here also the cannula can go here, like here and here I need, and I can go a little bit here and here. I speak about the man now. But also, and sometimes it look very nice with the man, but according to the shape, according to the shape. I go from here, like normally I go from the cannula from here like this, when I make the angle. But what about this part? Sometimes men really have retruded part from here, and it's this part also, you feel that it need augmentation, How you will do it? Like, I come with the needle to open for the cannula, like this, but in this direction. Here I make it like this. Here I open. You don't open like this. No, you should open the hole in the direction how I need to put the cannula. Also, like this. And I go like this. I go with the cannula. And by the way, there is here a lot of resistant and fibrosis, something like tissues, fibrous tissue. It will resist, like so. I make like this, change the needle, like until I hit with the tip of the cannula in this point, not in the middle, here. And I push the cannula and I start to feel the cannula, tip of the cannula push the skin. And then I inject, constant, keep injecting until I feel the volume, and then I go. Enough to do.